Good afternoon, everyone. Thanks for joining today's Talk They Hear You partner webinar, Preventing Underage Drinking in Rural Communities. My name is Josh Ferrari, and I support outreach and communications for the campaign. Today, we will hear the best practices for implementing the campaign for rural audiences from groups in East Hampton, Massachusetts, and Newton, New Jersey. We'll leave some time for Q&A after each presenter and end with other announcements from the campaign. To kick us off, I'd like to introduce Robert Vincent, the federal officer responsible for the Talk They Hear You campaign.
Hello, everybody. Just welcome, and I'm glad everybody could attend today. Thank you for taking time out for your busy day. I'm very pleased that we are focusing on rural communities, and I certainly hope that this will be helpful for everybody. We look forward to your comments and questions and answers and those kinds of things. So please feel free. Josh, back to you, or am I doing introductions? I'm doing introductions. So let me welcome our team. So I'm Rob Vincent. I happen to be the federal official responsible for Talk They Hear You. My colleague, Nell Nadal, who is also works with me on this campaign, is my alternate on that. And with that, Josh, you're going to introduce the team, I believe, or is that going to be Elaine? Apologies.
Sure, Rob, I'll kick us off. Like I said, I'm Josh Ferrari. I support communications and outreach for the campaign. And with me on the contractor side is Lindsay Young, who also works in partnership and outreach. Emily Springer, who is the deputy project director for the campaign. And Elaine Robar, who is the project director for the campaign. And so with that, I'd like to go ahead and introduce our first presenter. We have with us here today Ruth Ever and Susan LaPointe, representing the East Hampton Healthy Youth Coalition in East Hampton, Massachusetts.
Hi, can you hear us?
Yep, we can hear you.
Okay. Hi, this is Ruth Ever. I'm the coalition coordinator for the East Hampton Healthy Youth Coalition. We're a drug-free community grantee in our 5th year and hoping to get refunded next year. And I have with me?
I'm Susan LaPointe, and I oversee the creative and marketing efforts for the East Hampton Coalition.
So East Hampton is in western Massachusetts. We're about 2 hours west of Boston. It's the rural, pretty part of the state. We are a small town, city actually, it's 16,000 population, over about 13 square miles. We're in a county that is mostly rural. It's about 50 miles across in the county and covers a lot of square miles. The total population is about 160,000. So we started, I'll just point out Mount Tom there in the distance. So we started the Talk They Hear You campaign in 2017 after we had done a social norms campaign, and we were pretty exhausted from that. Anybody who's done a social norms campaign knows that it's a lot of work, a lot of pre and post testing, and a lot of designing of the campaign. And so we decided for the next year we wanted to do a parent education campaign, but we wanted to find something that would perhaps be a little simpler to do, but would still be good quality and get across an evidence-based message in some way. So we looked around and were able to see that SAMHSA's Talk They Hear You campaign had all of that. And so in 2017, we ran our campaign during the school year, and in particular, we focused on promoting the Talk They Hear You app. We particularly like the app because we feel like it's not just a message, it's also an action that parents can take, and it's skill building. And so we did some things to promote that in particular, as well as use the images and messages from the SAMHSA campaign.
Yeah, like we utilized, as Ruth said, we utilized all that SAMHSA provided to us, and we were able to customize it with any sort of a message that we wanted to, which really made it fantastic. We first started with a 4-postcard campaign that ran to 4th and 8th grade parents. We also did paid advertising on Facebook and utilized a lot of the images on our website with our messages. Again, we made sure that the Talk They Hear You app was included in any of our materials for everybody to find the way to get information on how to download that app. And we even created our own sandwich board with the app images and used that image on a lot of other materials besides the sandwich board. Some of the other larger ticket items were like radio and TV and billboards. We partnered with our neighboring town coalition and put our dollars and efforts together to successfully make it happen. We'd like to share with you a sample of one of our radio spots that we ran. If we could play that now.
That's actually from this year's campaign, which we'll talk about in a minute, but we can play the radio spot now.
Yeah.
Your 10-year-old asks you if she can sleep over at her friend's house. You think at some point one of her friends might offer her some alcohol or marijuana. You want her to know what to do, to be prepared. Starting a conversation about it while she's still young is important. Today is the day to start talking. She needs to know what you expect of her and why, and help to practice a response that works for her. For tips on how to start the conversation, visit talktheyhearyou.org. That's talktheyhearyou.org. Brought to you by your local prevention coalitions and partners.
So here are a few of the other materials that we utilized the Talk They Hear You campaign with. You see a lot of different options: table tents, travel mugs, and we also, something that isn't shown here, are lawn signs that were very effective.
We also used, like the travel mug we used as a giveaway in our Strengthening Families program, our Strengthening Families 10 to 14 program. So we were able to combine the Talk They Hear You message with other educational programs that we were doing. And we have an annual parent guide that comes out that we partner with other coalitions on, and we wrote basically an article about Talk They Hear You and promoting the message with it. We were happy with the results that we got from that 2017 campaign. There was a measurable increase in the downloads to the app that we heard from SAMHSA, and they said that Massachusetts was among one of the top sites that got visitors for the campaign. In our own surveys that we did post-campaign, we found that about 85% of the parents said that they had talked to their team during that time that we were running the campaign, and another 11% said that they planned to. So we were really pleased with the results on that. So for this year, we decided to expand our campaign regionally to get a little wider. We thought that this would get us a bigger bang for our buck. We are not a very resource-rich community. It's a rural county. And so we figured if we could sort of pool our resources, we have a few areas where we have overlapping media markets, and that would be an advantage for us to do that. We thought it would also be more fun to work with other coalitions and other partners in the area, and again, as I said, get a bigger bang for our buck.
So we started our regional efforts by having some initial planning meetings to share how we use the Talk They Hear You materials and its successes in using it locally. We've got many DFC coalitions in the surrounding area that we were able to partner with, both in effort and fiscally. We also reached out to community hospitals, the DA's office, and mental health agencies to partner with us. Now, with 12 partners, we needed one location for all the interested to pull information from. So we created a landing page, actually, with the URL talktheyhearyou.org. Finding that this was available, we were able to have one place for everyone to access information from. They could go directly to the SAMHSA site. They can learn how to download the app and utilize it. And then all of our partners, there's a direct link to all of their sites that they could get to from this one location.
So at that point, we're currently running our radio, TV, we've got Facebook ads, and all of the partners are running concurrent messages on their sites, on their websites, on their school pages. They're doing their own postcards home. And so, as I said, we're hoping to have a unified message across multiple communities and get more bang for our buck.
Okay, a little animation there.
So some of the lessons learned was that you want to allow additional time, more than you think you need. We ran into some snags with figuring out billing with everybody. It got a little complicated with that many partners. We ended up being sort of the main source and having working directly with radio and TV and then invoicing the other groups ourselves. We did some customizing of the TV and radio, again, with our wanting to put our own URL on it, and we had to find partners to work with to do that in a efficient way that wasn't going to cost us a lot of extra money. Not all the media platforms are necessarily going to appeal to all your partners, so because we had been doing some intercept surveys at back-to-school events and various community events that we table at, we had a very short little survey that we would ask parents just over the last couple of years. Where do you get your information about parenting? What's the primary source of where you go for information around the school? What radio stations do you listen to? What news and media sources do you use? And that was really helpful for us to then find where to put our dollars and to find overlapping radio stations with other communities. TV is a little easier. So we were able to be strategic in how we used our dollars.
And having one point person to work with the vendors and the media certainly keeps the lines of communication clear. And it's always something that we would recommend, is having that one point person.
So just some last key takeaways is, I've already addressed some of these about being prepared to cover the costs and figure out how to do that if you're going to work with more people. It was great working with Susan as a graphic designer with her connections in the community. And I would just put in a plug for, be open to finding partners in places you might not expect it. I mean, Susan is someone I hired as a local graphic designer and ended up becoming a real advocate for our coalition and donates a lot of her time to our cause and to our work, and is able to put connections out in the community that we would never have had, and really get us a lot of discounts that she has.
Sure, yeah. As the coalition's creative resource, I was able to share my relationships that I have with a lot of the local printers and media and help negotiate some pricing and some media buys.
And the last thing is to say that SAMHSA is here to support our work, and a lot of times people forget that we can turn to them as a resource, and that the folks who are doing the Talk They Hear You campaign have been really great to work with, have been very flexible, have sent us editable files when we need them, things like that. So we definitely thank them for that.
Yes, thank you so much. It was wonderful.
And that's all we have.
Yes.
Great. Well, thank you so much, Ruth and Susan. We have a few minutes here for some questions, so if anyone would like to ask a question, it looks like we've got one already on the screen, but you can go ahead and type one on the screen using the Q&A box. Or if you have a verbal question, you can dial #6 on your telephone, and it will unmute your mic so you can ask it yourself. So why don't we go ahead and start with this first one here from Paige Coleman. It says, what did staff do versus what did your coalition membership do for the campaign implementation?
Yeah, so we had a parent engagement work group, and that group has been mostly responsible for working on the various campaigns when we're doing parent education. We had our graphic designer, Susan, doing most of the actual customizing, making the postcards, that kind of thing. The staff definitely did the sort of day-to-day work of getting the mailings out and kind of keeping track of things. We had volunteers helping. We had lawn signs that we put up, so some of our coalition members were helping to distribute those in the community and keep track of them.
The table tents and the postcards all were a community effort to get those out into the community. Yeah, team effort. So.
Yeah, there's a lot of it that the coalition membership can do depending on the structure of your organization. If you have a work group that is looking at parent issues or is doing outreach or media work, those are all great places to bring it to them and get their feedback and get their buy-in, and then work with whoever's doing the, the designing.
Great. It looks like we have a few more questions here. The next one's from Dawn Holland, and she asks, how long was the process from start until the campaign was up and running?
So the regional campaign, we had our first meeting in about August of, like, I don't know, 8 months ago.
Right, would have been August of 2017.
Right. And it took the full 6 months until January to kind of get things planned, and it went a lot slower because we were working with so many partners, and there were complications with just figuring out how we were going to pay for things and how much money could people give, and they have to go back to their executive committees or their, funding sources or whatever, and get permissions and figure out their budget. So that took a little longer, and in fact, we had to negotiate some things with the radio and TV, so it really didn't start until the end of February. It's just February.
Well, I think we were within our target, so allow that 6 months. Start in the summertime, and definitely give yourself the time to get through some of the glitches. Yeah, thank you.
And it looks like you might have answered this one from Liz Tennant, but it sounds like you all ran the campaign during the school year, like the second half of the school year there. So I'm just going to clarify that.
The previous year we ran it all year, and this year it's going to run basically, January, February until June.
Great, thanks. Another question here from Jennifer Graves. Do you feel that this message would also work in non-rural communities, and how?
Well, probably you can answer that better, Josh, but I don't see why it wouldn't. And I believe you test marketed across varied communities, isn't that right? Josh, do you want to answer that one?
Actually, Emily Springer, who's a member of our team here, is going to take this one. So, Emily?
Yeah, thanks, Josh. No, just chiming in, and thank all of you for joining. Absolutely, the campaign has been tested and pilot tested, and every year we do focus group testing in communities all across the country with real parents who provide feedback on our materials. So, absolutely, the campaign continues to sort of take inputs from parents and roll out the campaign. So all of our resources and everything on our website is available for communities and coalitions and schools to use with their parents in their communities. So everyone is welcome to those.
And what I would like to just add is that we have particular things in our community. Like we actually have quite a big lesbian community in particular, but sort of gay, LGBTQ community here, and so we were able to work with SAMHSA to say, do you have images of this? Do you have images of that? And they actually were able to get us. They already had some images of families of two parents that were both women and a child in it, and that actually worked great. So that went on the billboard in between Northampton and East Hampton, and so every community has sort of their different demographic, but I feel like there was enough diversity in the images that we were able to make it work for us.
Absolutely.
Great. We're obviously certainly happy to hear that as well. Another question here from Liz Tennant. Were you able to use DFC funding for the campaign?
Absolutely, yeah. We were, with our partners, we had other funding sources as well, but we built into our budget. We have an advertising budget for doing parent education and doing outreach. And this is an evidence-based educational campaign, so for us it totally fits in with the no use, setting clear expectations, talking to children kind of message that is a big part of the work that we do.
Does anyone else have any questions on the line? Well, Ruth and Susan, we actually have a question for you all as well. So you talked a little bit about how groups can sort of pool resources and go toward, work with partners on sort of an expansion of the campaign. I know you briefly touched on how you use existing relationships with some of the other coalitions in the area and how you reached out to new groups like the hospitals that you were saying. Sort of how did you phrase that ask when you first approached them, and what was that process like when trying to get them interested in using the campaign with you?
Yeah, thanks for asking that. I knew that a lot of the other coalitions and the DA's office, people that were already partners with our coalition and with a number of the coalitions were interested in the message of this. And what we were able to offer is, as a sort of lure, was the images, the messages, the postcards, all of the work that Susan had put in that our coalition, paid for her time, a lot of it. We offered that for free to everybody. So it was even easier for the other coalitions. It's like, here's ready-made, postcards, table tents, everything's sized, everything's got its image, the messages are there. Of course, you can change the message to your community, put your own coalition name on it, et cetera. But I think that was appealing to a lot of other groups. We had some newer coalitions who were just getting started, and so it was great for them to be able to jump right in to working on this and not necessarily have to start from scratch and have already ready-to-go stuff. So I think that was part of the appeal. Do you want to add anything?
I certainly, from when we met for those initial planning meetings and, having that as a talking point, I think there was an ease of mind that they could get started right away and not have to worry about, oh my gosh, we need to come up with this and that. And so it just solidified why we need to do and put our efforts together regionally. So I think it was really just a good starting point for us to be able to offer that.
And we already know that these are the key messages that we need to get across. So I think that presenting it that way to our partners, that this was a way to promote protective factors and reduce risk, and use a program that's in line with the evidence-based work that we know we want to do, and it's data-driven. So it kind of aligned, I think, for everybody that came to the table understood that.
Great, thank you. We have another question here from Paige, and I think I might be able to answer this one for you, Paige. It's where and how do you access the campaign from SAMHSA, and is there a fee for the campaign? So all of the resources from the campaign are online on samhsa.gov. The URL is underagedrinking.samhsa.gov. And again, it is a federal campaign, so all the resources are available for free to use for your coalition or organization. And if you do end up using the campaign, we'd love to hear from you and how you're using it. Every organization that uses the campaign is assigned a license number that just lets us know, that you're using the campaign, what you're using it for, and again, helps us help you in the long run as well, as far as if you have any questions about the use of the campaign or how to customize materials or anything like that. So if you have any specific questions about that, feel free to email us at underage.drinking@samhsa.gov, and we'll go ahead and put that on the chat box for everyone to see. So that was that. And then we have another question here from Liz. So it says, although your 2018 campaign has not finished, how would you compare 2017 to 2018? What are the pros and the cons to your different approaches there?
Well, the 2017 campaign was in some ways much simpler because we were in control of everything that was happening, and our coalition could make all the decisions. And so in that sense, I'd say it was ironically a little bit less work. I thought it would maybe be less work to expand it. That was a little bit naive on my part because it did end up being a fair amount of work, pulling in the partners. What I would say for 2018, the main advantage is that I'm hoping that we're going to get a bigger bang for our buck because people do travel across the county. And also are, on the radio and TV, especially those are the most expensive parts of doing a media campaign. And so being able to pool resources with more people got us more media buys. And so that's definitely an advantage. We're on 2 radio stations and the television station. And so I think that's probably the main advantage. And we're hoping to do billboards again. Those are harder. You can't pool resources with a lot of people on that because it's just a road between 2 towns or something. But we are hoping to do that again because what we did find in our surveying was that the most seen images that we used were the billboards and the lawn signs, actually. And then after that, I think Facebook. So it was a good for us. In fact, we did not do posters the next year because we just found that wasn't really worth it, that people weren't seeing those as much. However, if they go to another community or they're shopping in another town, they might see them there, and the combination of just seeing them repeatedly, as I think probably everybody's heard, you know, they say you have to see something 8 times for it to really stick. So we figure they're going to be seeing it more often if it's across the county. It's actually across 3 counties, I should say that. It wasn't just Hampshire County, it was the county above and below us as well.
Great. And we have a follow-up here from Paige. She's asking what was the total budget and the amount that they contributed.
I believe that the total budget somewhere between $5,000 and $6,000.
I think it was about 5, actually.
Yeah.
I think it was that much.
Right, yeah, it was that. So that was the total that we combined amongst all of the partners to then designating what would be used for radio, what would be used for TV. I made recommendations as far as frequency and certainly getting feedback from all the partners as to which radio stations work best for all, and the message itself, the one that was best, that worked for each individual partner's demographic. So that was right around that, just right around that $5,000.
And originally we were going to put in, I think, maybe only 500, but I ended up paying for, you know, Susan's time, things like that, that didn't end up getting split between everybody. So I think our coalition ended up putting in more than that, but still under 1,000. We're pretty low budget here.
We did a lot for that number. We really, really did.
So we have a couple more questions here, and then I think we'll move on to the next presentation. But up next from Yolanda Hinkston, could you share the Intercept surveys?
Sure. I can send it to you, Josh, if you have a way to send it out.
Yeah, absolutely. We can go ahead and send it out with our recap email after the webinar in the coming days. And then our final question here from Liz. How actively were youth involved in the campaign, and what did they do to support campaign efforts?
That's a great question. We didn't have youth involved in this aspect of our work because it was a parent-focused education campaign, and just because of who we were working with and the kind of meetings we were having, this just wasn't something that we really brought the youth into, actually.
Okay, great. Well, if anyone has any other questions for Ruth or Susan, they've left their emails on the slides here, so we'll be sharing a recap email like I mentioned. We'll share the PowerPoint slides with everyone, and I think that they would welcome your questions if you had any more. So thanks again to Ruth and Susan for your fantastic presentation. And we'll now move on to Tina Owie from the Center for Prevention and Counseling in Newton, New Jersey.
Thank you, Josh. Good afternoon. My name is Tina Owie. I'm the Director of Prevention Services at the Center for Prevention and Counseling, and we're located in Sussex County, New Jersey, and I'm happy to be part of this afternoon's webinar. So the Coalition for Healthy and Safe Communities has been in existence since 1999. Our roots are firmly grounded in Sussex County thanks to 10 years of Drug-Free Communities grant funding. And we've been able to sustain our coalition since 2013, courtesy of New Jersey block grant funding, along with strong community partners. Our coalition consistently uses the strategic prevention framework to keep us fresh, relevant, and on target to address the needs of our community. Currently, our priority areas consist of underage drinking, prescription drug misuse, and illicit drugs. For the purpose of this afternoon's webinar, our focus is on underage drinking and how we use SAMHSA's Talk They Hear You campaign to enhance our underage drinking prevention work. So understanding our community is vital to the success of our prevention work, including our campaigns. in New Jersey, we have 21 counties, and we are the 17th most populated county. We have a population of 142,000, and we're a relatively rural county. Sussex County is part of the Skylands region, and this is a term promoted by the New Jersey Commerce, Economic Growth, and Tourism Commission to encourage tourism. We have several state parks and federal parks that have kept large tracts of land undeveloped. We're also home to what used to be called Action Park Water Park, which is now Mountain Creek, which offers both winter and summer recreation. Our median household is 86,000. Over 60% of our population travels outside of our county for work purposes. And our population is 88% Caucasian and 8% Hispanic. We have 24 municipalities, 11 municipal police departments, and our state police cover 13 municipalities. Within our county, we have 26 school districts and approximately 21,000 students. And I share these details with you so you understand why we chose to use Talk They Hear You in the manner that we did. So our coalition utilized the campaign commercial PSAs. Our coalition members sent op-ed articles to our local newspapers talking about the prevalence of underage drinking in our county among our school-age students. Our articles included campaign messages, but we also noted some positive trends among underage drinking that we're seeing in our county. And we still utilize the campaign materials, but we said, keep talking, they hear you. And again, we referenced our campaign materials, and we really pushed the app. We pushed campaign materials on social media platforms, the two big ones, obviously, Facebook and Twitter. And while we used social media all year to highlight the campaign, we really pushed the campaign in April for Alcohol Awareness Month, and then again in May and June for 8th grade graduations, sporting events. Plus, this marks the start of the season where our youth are most vulnerable to risk-taking activities, including using alcohol for the first time. We send out targeted emails to different sectors each week to our various distribution lists to highlight how they can each utilize the campaign materials. We use Talk They Hear You logo as a picture under our signature and had that link back to the campaign homepage. I'm going to get into community events shortly, but I'll just say that no matter how small or large the event or meeting we attended, we left behind Talk They Hear You business cards, postcards, and table tents. We moderate a website called parentadvicenewjersey.org, and on this website we often refer to Talk They Hear You campaign materials, including the conversation starters, PSAs. We also include links to other SAMHSA data and resources for the prevention of underage drinking. We partner with local businesses, including our specialty shops in Sussex County, which I'll get into detail shortly. But those businesses display postcards and business cards in their buildings. We're very fortunate to have strong relationships with all of our Sussex County school districts. We collaborate with them a great deal, often providing resources, toolkits, trainings, professional development, and we weave prevention tools, including Talk They Hear You campaign materials, into all that we do. These schools really provide us with various avenues to reach their parents and caregivers where they're at, whether it's sending information home in backpacks, having information displayed at conferences, available at sporting events, in the guidance office, nurse's office, and during after-school activities. So we've been implementing Talk They Hear You since 2013. And as a coalition, we're always assessing what is working, what's not working great, and what we can be doing differently. So I've taken some of what we consider our Talk They Hear You best practices in our community to share with you today. So our county is unique in the way that we have lots of farms, forests, parks, not too much industry. We looked at what is most unique to us and tailored our Talk They Hear You messages to fit our community. So for example, Mountain Creek is the largest attraction in Sussex County, recreational attraction in Sussex County. So we created on the ski lift a perfect opportunity to talk about alcohol. So in fact, we took that even a little bit further and localized it further. Our agency actually has a DFC grant specific to Vernon, so the end product here actually had our Vernon Coalition logo on it. But again, that was very unique to Sussex County. It's one of our biggest attractions here, both for our New Jersey residents, our county residents, but it borders New York and Pennsylvania, so it draws a big crowd. So we have an abundance of consignment shops and boutiques in our community. So we partner with them and we post campaign materials in the dressing rooms. We also collaborated with florists and dry cleaners around the 8th grade dance and graduation time, and then again around the winter formal time, and shared campaign materials including the errands, chores, and truck tent cards. So we find that it can be difficult to get parents out to evening events, especially in our community where, like I said earlier, over 60% of our residents commute outside of our county for work. So this means they're leaving pretty early in the morning and they're getting home typically after 5:30, 6 o'clock at night. And our parents are presented with that dilemma of choosing between attending a sports event where their child is playing or going to a school presentation focusing on substance use disorder. Most times the parent is going to choose going to the event their child is involved in. So as often as possible, we capitalize on where parents are to spread campaign messages. A few to mention: sports banquets. Our biggest football club provides every parent with a underage drinking prevention toolkit, and our Talk They Hear You campaign materials are distributed to all of those parents, and that's been done for several years. School playbills, whether it's the middle school play or even the high school play, there's an insert in the playbills. Back to school night, parent-teacher conferences. So although it's difficult to get parents out, if you involve youth, then parents, grandparents, aunts, uncles, they all come out. So involving them and having youth voice is so important. Our state senator comes to our town hall meeting where youth are recognized with their PSA, the winners of our PSA contest. Our state senator provides our winners with a certificate. Our coalition also provides winners and honorable mentions with a small gift. Prior to the awards ceremony, our high school kids provide a presentation. It's an interactive presentation using automated clickers on underage drinking. We utilize the Fatal Vision goggles, and we get about 100 individuals out for this event. And we get newspaper coverage, which carries our messages further. So involving youth is really important. So my screen is changing. Is that, Josh, are you flipping the screen?
No, that's not on our end. If anyone else is flipping the screen, let's let Tina advance her own slides for the time being. Thank you.
Okay. All right. Thank you. So personalizing our materials and our approach, capitalizing on what is already happening in our community, and hosting the town hall meeting, utilizing youth, would not be successful without our relationships in our community. As a coalition, we're always looking at ways to keep our members engaged and excited about our coalition work. For example, we recognize a coalition shining star every single month. And while we support our existing relationships, we nurture new relationships in an effort to increase capacity and further our prevention efforts and our campaign materials. So we maximize use of our local media. We have one main newspaper in our county and several smaller newspapers, which are the free newspapers that all residents receive weekly in their mailbox. Our coalition members submit letters to the editors, and we issue press releases, which include Talk They Hear You key points and materials. We also shared coalition tools on social media. We send our local radio station PSAs to air, and they air them free of charge for us. And we typically send them in April, and we ask them to run them April, May, and June, again, during the season where Alcohol Awareness Month and when the weather starts getting warmer, kids are more apt to try alcohol for the first time, so it's a great reminder. Okay. And again, we use our emails strategically in the fact that we send specific coalition sectors different ways in which they can help our community in spreading the word on using Talk They Hear You campaign materials. Okay, so our events. As a coalition, we partner and collaborate with all sectors of the community, including our school districts, local police departments, businesses, nonprofits, and our elected officials. And our most successful events to address underage drinking include involving these community partners and involving our youth. I had mentioned earlier our annual town hall meeting honoring youth. We also provide an array of professional development workshops, all which include the underage drinking awareness and prevention. We provide education for teachers and other school personnel at staff meetings where we focus on local drug trends, which always begin with underage drinking. We utilize Talk They Hear You campaign, the soundtrack at all of our events. So as parents are coming in or community members are coming in for an event while they're waiting for us to begin, we have that soundtrack playing, and then we typically have some artwork or some poster contest images that are scrolling on the screen while that song is playing. And then again, at the end of the presentation or coalition meeting that we might be having, we're playing that song again, and we continue to show images that our students across the county have created for Alcohol Awareness Month. So for several years, our coalition has distributed partner toolkits during Alcohol Awareness Month, and that's what you can see here in the right-hand corner. So we send this email out to all 26 school districts in our county, and they send us back a little order form on what they would like our coalition members to deliver to their schools. And, I mean, we have everything from lawn signs to prevention of binge drinking, underage drinking on college campuses, the Talk They Hear You campaign materials. And again, that's a partner toolkit for our schools, but even for our nonprofits in the community, we can tailor a nice package for them. And again, our coalition members will distribute them. It's one of our more popular Alcohol Awareness Month marketing pieces. So just in closing, I'd like to share one more best practice in marketing the Talk They Hear You campaign. We kicked off last year Alcohol Awareness Month at our coalition meeting in early April with a special coalition meeting called Coffee, Tea, Underage Drinking Prevention in May. And this meeting included 30 members representing nearly all sectors of the community and was focused solely on underage drinking prevention. Talk They Hear You campaign materials were distributed within our coalition. We provided an on-screen demonstration on how to use the app, and we also showed how easy it is to navigate the Talk They Hear You campaign homepage in order to find tools that would be relevant to their specific town or their specific agency. It was a great event to share resources, including campaign materials, but to also just provide education regarding underage drinking, other materials that SAMHSA provides, and it empowers our coalition members to move forward in the prevention work that we're all doing. So I believe that is all I have to share with you this afternoon. Does anybody have any questions?
Great, thanks, Tina. And just as a reminder here, if you'd like to ask a question, you can go ahead and type it on the screen in the Q&A box, Or if you'd like to ask a verbal question, you can dial #6 on your telephone keypad, and it will unmute the microphone on your phone. All right, Tina, looks like we have our first question from Liz, and she's asking, what was your budget for the campaign?
Like our earlier coalition, we have a very small budget. All of the materials that we get from SAMHSA, they're free to us. So I guess you could say we stockpile and we download all of the free tools off of the Talk They Hear You campaign toolkit. So I would say it was less when you consider printing and some of the specialty lawn signs we had made. I would say it was less than $1,000.
Great,
and I'll
thank
say
you.
that with that, I'll say with our campaign materials, anything that we have to send out of house to print, we have fabulous relationships, and really it's all about that relationship building, and they offer us very generous discounts because of it's the work that we do.
Great, and Tina, maybe you can talk a little bit about how you sort of started some of those relationships with the printers or some of your other community partners, and talk about maybe how they've evolved into them doing some pro bono work or discounts on some of the printing, for example. I think that might be really insightful.
Sure. Well, I think a lot of it speaks to our agency and the fact that our coalition has been up and running since 1999. We are a small county, and a lot of times we have similar faces at every meeting, and people just use the same printing and resources in our county. There's not, we have maybe 2 printers, or, there's not a lot to choose from. And we educate our community members and our businesses about what we're seeing in terms of substance use disorder in our county and underage drinking. And when they understand what the issues are in our county, they're more likely to want to help and be part of the coalition and do what they need to meet us where we're at so that we can all better serve the community together. And relationships, they just take time to build, and you need to nurture them and have some give and take with those relationships, and that's what we do throughout our entire county with our nonprofits and our businesses.
Great, and looks like we have a question here about evaluation and measurement. So can you go ahead and share the campaign's outcomes and the measurement tools that you used for measuring those outcomes?
You know what? If you want to send that to me offline, I can. I'll actually speak with our media rep who has all of that data. I was pulling it earlier, and I saw just from the one post very recently I think we reached like 350 with one post. But I can compile that and find that data and send that to you, Josh, if you want to include it in your recap.
Thanks, Tina. Yeah, absolutely. And Liz, I know that you asked this question here, so maybe if you want to connect with Tina offline, her email's on the screen, and she can get you some of those answers, but we're happy to share them around to Tina if you can share them with us. And we have a question here. Oh, I see. Thanks, Liz. Question here from Yolanda. Can you speak more about your monthly Coalition Shining Star Award?
Sure. Every month, our prevention team at our agency and our chairperson for our coalition, we take a look and see who was our shining star, who did the most outreach, who visited businesses, who was engaged in doing focus groups out in the community. And based on who was really the most active, we provide them with a Coalition Shining Star. So it's literally a star with their name on it, with just a little thank you, and we give them a candy bar and a T-shirt. It's great. It's that little acknowledgement, and it makes our coalition members feel good, and they're doing fantastic work. They're out there in the community.
Thank you so much, Tina. And I think that about wraps us for the Q&A portion. So thank you again for the amazing presentation that you just gave and for taking the time to answer all of the questions that we received. And if anyone has any other questions for Tina, her email is on the screen. Feel free to email her, and she'd be more than happy to connect with you. And so with that, I'd like to just go ahead and move into this next topic. So with the remaining time that we have on today's webinar, I just want to take a moment to encourage everyone on the call to think about the ways that you might be able to use the Talk They Hear You campaign in conjunction with some of the other prevention efforts that you might be doing this month, which is Alcohol Awareness Month. For example, you could use our discussion starter video at a community forum, or play the soundtrack again at a community forum, or share it on social media, for example, and a number of different ways you can use that. You can use our mobile application, which helps parents actually practice the conversation with their kids about alcohol ahead of time, and it responds, it has a number of different responses for different questions that are asked in the app. It's a really cool feature there. So just be thinking about how you might be interested in using the campaign throughout Alcohol Awareness Month, and if you have any questions or want to run some ideas by us, we're always happy to link up and share some best practices that other partners have shared with us in the past as well. So that's Alcohol Awareness Month. And then along those same lines here, we've recently revamped the brand guide for the campaign, which you'll see on the screen here, one of our pages, which the guide includes pointers on editorial guidelines, how to use our logo, and the many different ways that you can use the campaign products as is or adapt them for your own community needs. I know on today's webinar we talked about sort of the specific needs of rural communities, but there are a number of different photos that might resonate better in your community, for example, and we're happy to talk you through that process. But this guide outlines a number of ways that you can use the campaign and adapt it for your own coalition or organization's needs. And so after we wrap today's call, we'll send a recap email, and we'll share the slides from the webinar as well as this brand guide with you all, along with a few social media posts that you might be interested in sharing throughout Alcohol Awareness Month. So before we give closing remarks, I'd just like to share that we truly value and appreciate the ongoing feedback that we get from our partners. So thank you for being here today and for sharing your insights with us. We continue to improve the campaign because of those insights, and we're really appreciative of that. So, and with that in mind, we're considering to keep the next webinar on a more open-ended platform, sort of a forum style, to talk about some of the newer campaign products that we may be releasing in the upcoming year, as well as bounce around ideas for other ways that we get be of assistance to you all. So, Rob, I don't know if you have anything else you'd like to add or share some closing remarks.
I do. Well, first of all, let me just thank each of our presenters and everybody that attended today's webinar. Since the inception of Talk They Hear You, it is, I've been aspiring to build a good quality brand, something that I think that people could feel like they could trust in, was a quality product. We've put all of our efforts into developing quality materials, and I would certainly thank my contract staff, Josh, Elaine, Emily, the entire team that really works very hard and diligently to really have the discussion and listen to everybody about the feedback we're getting, whether it's national focus groups, polling our NPNs at CADCA, or any number of various things that we've all been involved in, to sort of listen to you, listen to what your needs are, your ideas around implementation and those things. And I would just open that door that please feel free to email me at the underage drinking at samhsa.gov. Sorry about that. And we'll be happy to get back with you to listen to your ideas. We are As Josh had alluded to, we are getting ready to go into next year's strategic planning, and as we do that, we would like to, just like many of you are using the strategic prevention planning framework, so do we. And so as we go into that cycle, we will engage everybody yet one more time. So I would suggest bring a friend. If there's a voice or somebody that when we start that particular conversation and invitation list, if you will. With that, I think that's it from my chair, other than to say thanks. We have a look to the future. We have a lot of new products coming out at the end of this year. And we will be developing some more as we sort of plan our work going forward. So with that, I would thank everybody for your time and attention to underage drinking, and more to come. Josh, I'll turn it back to you.
Thanks, Rob. And with that, I think that we can adjourn today's session. So thanks again for everyone for joining us on the webinar, and our email's on the screen if you have any questions or feedback, and we look forward to hearing from you.